Hello and welcome to another episode of PACOP Clinical Bites. My name's Laura, I'm one of the improvement facilitators, and today we're going to walk you through the outcomes, tools and processes. The PACOP Outcomes Collection. First off, let's talk about what it is. It's a standardised assessment, response and care planning process for residents with identified palliative care needs. Your home participates in the outcomes collection and the profile collection, so the palliative care needs were identified during the profile collection assessment. This might have been in the routine profile full assessment, or it might have been in the deteriorating resident tool. So the outcomes collection has 4 tools and 4 steps. Let's walk through them together. There are 4 tools in the outcomes collection process. They are the palliative care episode start and end details, the Outcomes Full Clinical Assessment tool, the Daily Symptom Assessment tool, and the 3-monthly Resident Snapshot tool. Let's have a look at the forms and I'll talk to you about how to complete them and why we do them. The Palliative Care Episode Start and End Details form is completed firstly on entry into the Outcomes Collection. This is after the need for palliative care has been identified and the clinician formally enters them into an episode of palliative care. So we can see at the top here we have the date and then we have the reason for episode care. Now we understand that many residents have multiple chronic and complex comorbidities. This item is specifically asking about the reason for the need for palliative care. At the end of the episode of the outcomes collection, after death or after the resident has had symptom management and is discharged back to profile collection, we complete the bottom half of the form. So we fill in the date and the reason for discharge or death, and if they died, where did they die? This is the Outcomes Full Clinical Assessment tool. It features 5 standardised assessment items and some additional questions. The PACOP SAS is a resident rated item. It allows them to advocate for what's really bothering them and causing them distress. The PSS is a clinician-rated tool and it allows clinicians to advocate for the perceived problems and needs that they see with the resident's care. It includes psychosocial and family items. Pain check is included for homes who use this artificial intelligence technology to identify pain in residents who have communicative or cognitive impairment and can't identify when they have pain to staff. The AKPS is a performance scale. And the RUG-ADL is a functional score based on the assistance and equipment that the resident needs for ADLs. The palliative care phase is allocated last based on the scores and the items that were completed previously. There's a place for clinicians to document if the resident has had a specialist palliative care consult in the last 24 hours. And there's a section for hospital leave or social leave. This is really important for clinicians to document if the resident was not at the facility and was unable to be assessed when the assessment was due. The form is completed as per the Assess Respond Plan protocol on a daily or weekly basis as indicated by the phase. And I invite you to watch our Clinical Bites video on the ARP protocol. This is the Daily Symptom Assessment tool. It's a daily form for the PACOP SAS Symptom Assessment Scale, and it's completed by care workers. So you can see here we've got our SAS ruler, and then a section down the bottom here for care workers to document the scores from a conversation what they've had with the resident and their assessment that the resident's indicating where their needs or what's really bothering them. At the bottom, the staff put their initials, and then there's a section here for how quickly the care worker needs to report the scores from the SAS to the healthcare professional or supervising RN so that they can assess in full using their full assessment and respond to any identified needs. There's also a comprehensive care worker guide on the back of the form for each of the symptoms for when the care worker is required to score by proxy if perhaps the resident can't score or communicate them themselves. The Assess Respond Plan protocol is a continuous cycle, and this ensures that we're continually reassessing for changes in need in our palliative care residents. We do this by completing the full clinical assessment or daily symptom assessment tools. We refer to the ARP protocol guides for evidence-based responses and clinical prompts for assessment scores. We address the immediate and anticipated care needs of the resident by reviewing and updating the care plan. But how do we know if the things that we put into place for our residents to meet their needs are actually working? We need to go back and reassess. And so part of the assess, respond and plan protocol is by following the phase as to whether we need to assess weekly or daily. And that's escalated back to the healthcare professional if there's high symptoms that need immediate attention. This is the Outcomes Collection's 3-monthly resident snapshot, and you'll see it's a continuation of the profile collection. So you've already done an amazing full assessment in the Outcomes Collection, and so we really don't need to go back and do the full profile assessment and ask you to complete it again. So we've taken the questions out and brought them over to a new form for you. So again, we've got the reason for care, and this looks at the diagnostic cluster, and it's asking what the main reason for their care was in the last week. And if they're in palliative care, perhaps that's changed since the last time we asked this question. We look at the Rockwood Clinical Frailty Scale, which is great for identifying vulnerability and risk for residents. There's a question on advanced care planning and decision making, communication and psychosocial wellbeing, information about recent hospital use, and a spot to notify of the last ANAC assessment. The 3-monthly resident snapshot assessment really allows clinicians to think holistically about the resident care and whether the need for palliative care is ongoing. Now, it might just be that someone is in the Outcomes Collection for end-of-life care and their routine profile assessment is due. They will continue on in outcomes. If there's a resident who's been in the Outcomes Collection for some time, maybe they commenced the episode for symptom management, and then 6 weeks later, they're still in the outcomes, but their scores are really well managed. And we do the profile collection here under the resident snapshot. It's an option for the staff to stop and think, do they still need to be in the outcomes, or can we discharge them back to routine monitoring under the profile collection? And so let's review the 4 steps of the Outcomes Collection. Step 1, complete the episode start and end details for death or discharge back to the profile collection. So when they start, you'll only fill in the top section. Step 2, the full clinical assessment tool. We use this within 24 hours entry into the clinical outcomes, weekly or daily, depending on the assess, respond, plan protocol, and before or after they have leave, whether that's hospital or social leave. Step 3 is the daily symptom assessment tool, and we invite you to refer to the ARP protocol for more information, and that's daily by the care worker. Or step 4, complete the 3-monthly snapshot when the routine profile assessment is due every 3 months, or if the resident's fairly stable and you want to make a pause point to see if they can discharge back to profile or if they need to stay in the outcomes. Thank you for joining us. I hope you've enjoyed learning more about the Outcomes Collection processes and tools, and be sure to check out our other Clinical Bites videos. For more detailed information on the PACOP assessment tools, you can ask your local PACOP contact or send us an email to pacop@uow.edu.au. Thanks for joining us, and I hope we see you again soon.